Okay, and have the links been posted everywhere? That's the link there, and that's the link on Facebook as well. Yep. Right, so I think we can start. People are coming slowly. So, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, whosoever is watching us today. Welcome. I welcome you all to this very anticipated presentation by Dr. Ahsun Siddiqui and Dr. Tehrim Khan. I'm really honored for them being my guests here today on my platform, and I'm really looking forward to this discussion regarding the couples match and how things go around the couples match and many other updates, because they are they got matched this year. So if you have any questions, please do drop in the chat box. You can drop them on all the WhatsApp groups as well, and you can also drop them on the group Medical Pills, and then I'll post them to the guests in the end. So without any further ado, I'll mute my mic, and please, the mic is all yours, Ahsun and Tahrim.
Thank you so much, Dr. Osam, first of all, for a lovely introduction.
For having us.
Yeah, for having us
Thank
over
you.
here. Thank you so much. So for people who don't know me, I am Dr. Ahsun Siddiqui. Both of us actually from the class of Falcons, 2015 to 2021. We both graduated from VA Medical College in May 2021. And just a little background, after graduating, we started our house job in June 2021. उस टाइम पे हमारा प्लान ये था कि हाउस जॉब कंप्लीट करेंगे, उसके बाद स्टेप 1 देंगे, उसके बाद स्टेप 2 देंगे, लेकिन उसके बाद प्लान चेंज्ड. We felt like a house job wasn't really working out for us. So after completing my medicine rotation, we both started our step prep. और उसके बाद we gave step 1 in May of 2022. And I think Tahrim took it
Yeah,
in.
mine was, I think, in August. Yeah, it was like August of 2022. So,
And then I took my step 2 in June 2023. And Tahrim took it in July.
July 2023. Yep.
And then you prepare for your application for the residency match. So हर साल residency match की deadline is September. So from June, July to September, we did our observerships, we prepared our CV, we completed our personal statements, and then we applied to around 170, 180 programs, all internal medicine. And from September 2023 to January 2024, we had our interviews. All of them were virtual. अब बहुत कम programs हैं जो कि on site बुला के आपको interviews कराते हैं. So after COVID, that has changed. And that saves up a lot of money for you personally. और उसके बाद March में you get the results of the match, and we both matched, alhamdulillah, at our number 1 choice. And then recently in July, we started our residency. So that's our story. Or
do you want to start with like talking about a little bit about the couples match and how?
Yeah, sure.
Just to touch on that, like it overall, we're calling it a couples match because when we were interviewing, so let's say he had 4 interviews. That this is an example. Whenever he would interview at a program, he would say, "Oh, my wife is also applying to internal medicine this year, and it would be nice if you could consider her application as well." So this was our strategy throughout the match. We didn't end up coupling our list at the end. So it wasn't like a proper like couples match, but it, in a sense, we were.
So I would simplify it.
Yeah.
So during the process of the residency match, there are 3 big organizations that you deal with. One is the ECFMG. ECFMG deals with your USMLE step 1, your step 2, your certification. Then comes the ERAS. ERAS is Electronic Residency Application System. This is a system that you use to upload your letters of recommendation and then apply to programs.
Yep.
The proper couples match is that you both couple at the time of ERAS. जिसमें आप सारे प्रोग्राम्स को पता लग जाता है बिल्कुल स्टार्ट से दैट यू बोथ आर अ कपल।
Yeah.
तो उसमें लेकिन उसमें जो नेगेटिव है वो ये है कि programs think that we have to take both of them.
Yeah.
So if they have 10 slots, they would be like, okay, इन दोनों ने couples में apply किया है तो हमें दोनों को लेना पड़ेगा। The other strategy is कि आपने initially उनको नहीं बताया कि हम as a couple हैं apply कर रहे हैं, और बाद में when you get an interview you tell the program that okay, my wife is also applying to the same program in internal medicine, or my husband, and then usually programs oblige and they send an interview to your spouse as well. So at the end of everything, at the end of the interview season, there is the third organization, that is the NRMP. NRMP only deals with your rank lists. तो जो जिस तरह आपने लेट से आई हैड 9 इंटरव्यूज, तो आपने अपने 9 इंटरव्यूज को रैंक करना है उन प्रोग्राम्स को। अब NRMP के लेवल पे यू कैन अरेंज योर लिस्ट इन अ वे कि आपका और आपकी वाइफ का सेम जगह पे या फिर सेम लोकेशन पे आपका मैच आए। तो इट्स जस्ट दैट यू पेयर योर रैंक लिस्ट्स। तो हमने इस तरह किया था।
Yeah.
एंड एक और बात ये जो कि लोगों की बहुत बड़ी मिथ है कि ओनली हस्बैंड एंड वाइफ कैन अप्लाई फॉर अ कपल्स मैच।
Yeah. Anyone.
That anyone can apply for the couples match.
Hmm.
You could be brothers, you could be
Yeah.
friends.
Yeah.
The only thing you need to do is after your interviews are done, you just need to pair your rank lists, and that is the only thing you want.
Pair as in
Pair,
not
pair is in
join or tell programs के you have to take us together. ऐसे नहीं, but इस तरह basically we were able to increase the number of interviews for each other by just talking to the program. And then if they did extend out an interview, we created our own lists at the end. It wasn't like we paired our lists up. We had like separate lists, but ये था कि our number of interviews around the same area increased, if that makes sense.
and then you can, let's say I had 10 interviews and my wife has 10 interviews. तो अब आप अपने 10 and 10 को मिला के you can make a paired rank list of about 100,
Yeah.
क्योंकि आप 10 and 10 के हर तरह के, let's say my best program is in Chicago and मेरी wife का भी best program is in Chicago, so that would be our number one. Then if मेरा प्रोग्राम इज इन शिकागो, फिर आप दूसरा इन इंडियाना कर सकते हैं, फिर तीसरा, सो यू कैन मेक अ लॉट ऑफ, यू कैन चूज कि आप किसको ऊपर रैंक करना चाहते हैं। आप दूर भी मैच हो सकते हैं, करीब भी हो सकते हैं, टोटली उस पर लक पे है कि अगर आपका टॉप पे हो जाता है तो यू वुड बी रियली क्लोज टू ईच अदर। अगर आपका कहीं नीचे हो जाता है, लेट्स से यू आर रैंक्ड लोअर इन द प्रोग्राम्स लिस्ट, तो so this is a little complicated for couples who are actually going for it. I feel like they can reach out to us personally as well. And then we can guide them better क्योंकि थोड़ा सा technical stuff है. Let's move on to the questions because I have received a lot of questions over the past 2 days. So I made a list of them. So let's start with that. Okay, so this is a question I think जो कि बहुत सारे students का है कि I am a second year student with low marks and scores in profs and tests. Can I go for the USMLE? I am being discouraged by family and friends. Okay, you want to take this one?
I want to do this one. So I just want to let people know you don't have to be at the top of your class. You don't have to be super smart or a genius or anything like that. I was not in the top 10. I was not in the top even 30 of my class. And I was still able to do it, but it's just all about your consistency and patience and your dedication. और इससे related I have a story as well. क्योंकि so I basically did like all of my education in the US and went to Pakistan to study medicine. So I was in second year and somebody came up to me and they were like, because maybe people thought I wasn't smart enough, and they were like, oh, USMLE तो बहुत मुश्किल होता है, तो तुम कैसे करोगी? And I still remember that. It was such a long time ago, but I do. And it's just don't let anybody underestimate you. If you want to do something, go for it. इसमें कोई ऐसा वो नहीं है कि you have to be really smart या you have to know बहुत सी चीजें या profs में top करो या कुछ इस तरह. If it's just all up to you.
और दूसरी बात कि आपके मेडिकल स्कूल के टेस्ट दे डोंट कोरिलेट
Yeah.
टू द यूएसएमएलई परफॉर्मेंस, जो बेसिक बात है. यस, द डिसिप्लिन डज, अगर किसी की अच्छी स्टडी रूटीन एंड दैट ऑफ कोर्स would go, he can continue that in his USMLE prep. But जो आप फर्स्ट ईयर में सेकंड ईयर में आप पढ़ रहे हैं, द एनाटमी, द बायोकेम, द फिजियोलॉजी, that is totally different from what the clinical aspect is, or what you should know for the USMLEs. USMLEs के जो materials हैं, study materials, the testing materials, they test on stuff that is totally different from
Yeah.
that. So आपकी अच्छी study strategy इस तरह हो सकती है कि you don't rely on your medical school solely for teaching you those subjects. You use stuff like Kaplan for biochem. You can use let's say sketchy for micro in third year and stuff like that, because you have time when you are med school. तो आप उसको यूटिलाइज कर सकते हैं, और अगर आप वो अच्छा करते हैं तो देन यू कैन टोटली गो फॉर इट. और डोंट बी डिस्करेज्ड बाय आपके आसपास के लोग. हाँ, बिकॉज लोगों की अपनी इनसिक्योरिटीज होती हैं, लोगों के अपने एक्सपीरियंसेस होते हैं, that does not correlate to your personal story. So I always say कि आपकी strategy is very important, your guidance is really important. आपने किस टाइम पे स्टेप्स करने हैं, आपने किस टाइम पे कौन से रिसोर्सेज यूज़ करने हैं, कितने प्रोग्राम्स में अप्लाई करना है, कैसे अप्लाई करना है, सॉरी, सो दैट मैटर्स.
And also एक चीज कि when you're starting off for your preps for steps, it's okay if you've forgotten stuff from med school. मुझे कुछ भी नहीं याद था when I first started, because it was a long time ago and I started preparing after I was done with medical school. So क्योंकि the way that they teach you in steps is just so different कि it's fine if you're starting off with like a clean slate. So it's very normal.
लेकिन एक चीज़ जो ज़रूरी है ये है कि आप
निकाल सकते हो, right? And we can
sorry, wait.
Sorry about that. Somebody was not muted. I've muted them now. Please carry on.
Okay, no problem. अच्छा, तो आई वाज सेइंग कि आपकी स्टडी स्ट्रेटजी इज़ वेरी इंपॉर्टेंट एट दिस स्टेज. आपको गाइडेंस लेनी चाहिए अपने जो WMC सीनियर्स हैं उनसे, वो बहुत हेल्पफुल हैं. आई शुड मेंशन एंड आई मस्ट मेंशन के व्हेन आई वाज इन सेकंड ईयर आई टॉक टू डॉक्टर यासिर सत्तार एट दैट टाइम. उस टाइम में मुझे बिल्कुल कुछ पता नहीं था USMLE का, एंड ही वाज द वन हु फर्स्ट टोल्ड मी के ओके, अपने कॉलेज से के okay, yes, this is something totally possible and you can do that. Then later on, in fourth year, when I was studying for my steps, I talked to Dr. Hassan bin Arshad, Dr. Saad Wasik bhai. These are the people who have helped me in my journey. They have reviewed my CVs, they have reviewed my personal statements. So I must mention Dr. Talal Badlas. He helped me a lot. एंड तो आप अपने इन सीनियर्स के साथ जब इन टच रहते हैं तो तब आपको रियलाइज होता है कि ओके, यू डोंट नीड like 50 publications to match, you don't need a stellar score to match or हमेशा, you don't need to do this or that or फलाना. तो that is how you learn. तो stay in touch with your वो seniors who are in the US, इंस्टेड ऑफ योर दोज पीपल जो कि आपको नेगेटिव एनर्जी आपको दे रहे हैं. सो स्टे अवे फ्रॉम दैट. और इवन बल्कि आई थिंक आई वाज डन विद माय स्टेप 1 एंड स्टेप 2, एंड देयर वाज अ consultant in POF who said that internal medicine is super saturated in the US and you can't get there, or आप तो मैथ्स के लिए अप्लाई कर रहे हैं, this is like totally useless. And okay, and I was about to apply for the match. I was done with my steps, and so people would discourage you at every point. So you don't have to take that to heart and just know your abilities and then go for it. So I think this was this was a detailed answer for that. Lekin I think there are questions later on, so we will get back to this subject again.
Just if you guys allow me to comment a little bit on that discouragement part. तो आप लोगों का तो ये सीन है ना कि आप लोग अभी लेटर बैचेस में हैं. I mean, you guys graduated pretty much 10 or 9 years after I graduated. So I graduated in 2012 from Wah Medical College. मेरा fourth batch था. तो लिटरली जिस तरह आपने कहा कि आपने साद वासिक से बात की और यासिर सत्तार से बात की, ये सारे मेरे मतलब के जूनियर्स थे. तो लिटरली when we were going through this stage, we literally had no one. And you know, that is the whole point कि मैंने जो ये पूरे प्लेटफॉर्म क्रिएट किया और जिस तरह मैं टॉक्स अरेंज करता रहता हूँ ताकि स्टूडेंट्स को पता चले कि there are people out there who are ready to help, not just alumni of our college but other people as well. और जहां तक डिस्करेजमेंट की बात है ना, वो चाहे आप यूएस परस्यू करें, यूके परस्यू करें, ऑस्ट्रेलिया परस्यू करें, या फिर इवन अगर आप पाकिस्तान से भी अगर आपने एफसीपीएस या एमएसएमडी करना है ना, तो हर चीज के लिए डिस्करेज करने वाली अवाम रेडी है हमारे माशरे में अनफॉर्चुनेटली. ठीक है. तो मैं इस तरह की मतलब के एग्जांपल देता हूँ कि आज राइटफुली जिस तरह आप लोगों ने किसी का नाम नहीं लिया, मैं भी किसी का नाम नहीं लेता, बट देन देयर वर पीपल who would say कि मेरे 10th स्टैंडर्ड में, जो मैंने मेरी एजुकेशन पाकिस्तान में हुई है, 10th स्टैंडर्ड में मेरे मार्क्स एडिक्वेट नहीं थे. तो जिस बंदे के 10th स्टैंडर्ड में 10th क्लास में मार्क्स अच्छे ना हो, वो किस तरह वेस्टर्न कंट्रीज में अपने आप को एस्टैब्लिश करेगा? आई मीन जस्ट ट्राई टू लुक how this person is trying to establish um, what I was in the school compared to what I would be in my professional life. और उसकी फिर मैं मतलब आखिरी बात करके then I'll stop talking. जब जो सबसे बड़ी मेडिसिन की इंटरनल मेडिसिन की क्वालिफिकेशन है यूनाइटेड किंगडम में, इट्स कॉल्ड एमआरसीपी. जब एमआरसीपी की तैयारी करना मैंने यहाँ पे आके स्टार्ट किया, तो बिल्कुल वही आप लोगों वाली बात कि इट जस्ट फील्स लाइक यू आर गोइंग थ्रू मेडिकल स्कूल एंड द मेडिकल स्टफ ऑल ओवर अगेन. क्योंकि जो एम्फेसिस एथिक्स पे है, जो एम्फेसिस पेशेंट कॉन्फिडेंशियलिटी पे है, बेडसाइड मैनर्स पे है, वो दैट इज जस्ट टोटल न्यूज टू यू, जो कि हम लोगों के करिकुलम्स में बैक होम नहीं होता. ठीक है. एंड इट इज एक्चुअली नॉट अ वेरी डिफिकल्ट साइंस. वंस यू गो थ्रू इट, you practice it enough, you do get a flavor of it, and then later it becomes your second nature. So anyone in the audience today who cannot do USMLE, who thinks who cannot do MRCP and so on, please know कि ये जो सप्ली है मेडिकल कॉलेज की, ये जो आपके मैट्रिक के मार्क्स हैं, इनका कोई ताल्लुक नहीं है USMLE से और प्लैब से और MRCP से. That's all I wanted to say. Thank you.
यस, थैंक यू,
Thank you so much for adding this.
तो वही बात है बिल्कुल कि पीपल वुड डिस्करेज यू कि आप मेडिकल स्कूल में नहीं जा सकते, आप मेडिकल स्कूल से गुजार के आप डॉक्टर नहीं बन सकते. देन दे विल डिस्करेज यू कि आप यूके नहीं जा सकते, ऑस्ट्रेलिया नहीं जा सकते. इवन पाकिस्तान में भी लोग एफसीपीएस को भी लोगों को डिस्करेज करते हैं. सो यू जस्ट हैव टू गो थ्रू इट. एंड इन टर्म्स ऑफ गाइडेंस, सिर्फ अपने मेडिकल स्कूल की हद तक आपने नहीं रहना. Always go through अपना YPC group is there for American Pakistani physicians. US residency match groups हैं. So always be in touch with all of those people. I was in touch with people from Allama Iqbal, from King Edward, from Dow, from Aga Khan, and these are the people who have actually set the path for everyone. क्योंकि Dow से I think this year 100
Yep.
Students matched.
The largest
Yes,
number.
I think Aga Khan say I think 50 matched. King Edward say I think 70, 80 people matched. And this is like 1 year.
Yeah.
This is not this. So these are most of these people are like graduates of 2021, 22. So unki almost 20% class has matched in the US. And you can scale it to your own medical school. Okay, okay, we don't have enough students, but we need to create a culture of going for
Yeah.
the USMLE. आपको पता होना चाहिए. ओके, दाव में ये होता है कि मेरे फ्रेंड ग्रुप में अगर 3 लोग कर रहे हैं तो मैं भी कर सकता हूँ. दैट इज पॉजिटिव एनर्जी. You get that from your group, you get that from people. You are applying for the visas together, you're going for observerships together, so everyone has each other's back and they help each other out. तो उस तरह कल्चर बनता है.
और जितना आपका alumni strong है, it'll be so much easier for the people that are going to do it later on. क्योंकि I've noticed DAO के जो लोग हैं अब, they're getting, उनके बच्चे are getting like research positions, like the 1 year research positions that you can do, and then you can get into competitive fellowships as well. And some people even pre-match into a fellowship, like residency plus fellowship, because they've done that research year. So जो DAO के जो पुराने graduates हैं, when they're leaving those positions, they're giving it to जो बच्चे USMLE अब कर रहे हैं, so इस तरह आपका alumni जब इतना strong होता है, they assist you and they help you out in ways जो कि मतलब हमारे लिए थोड़ा भी मुश्किल है क्योंकि हमारी alumni is not that strong in the US. So
I think our alumni is good enough for internal medicine. Internal medicine is a specialty, is like a generic specialty for everyone to get into the US. जो मैं दाव या आगा खान के लोगों की बात करता हूँ और काफ़ी लोगों ने मुझसे सर्जरी का क्वेश्चन पूछा है कि कैन वी मैच इनटू सर्जरी एंड स्टफ so your alumni helps you to get into those competitive specialties. They can help you to get an observership, they can help you to get a research position. I know people who have a research position at Duke University, at University of Mississippi. तो इस तरह के लोग आपको help out करते हैं to get those positions, and then you can apply for specialties like radiology, which are very competitive, dermatology, surgery, and stuff like that.
gynae ops, anything
Yeah.
like yeah.
So that is where we need to improve as an alumni. So okay, let's take another question. Should I take steps before graduation or after graduation? What should be the perfect time for taking these exams? Okay, so now that step one is pass fail, you can take that in fourth year. The best time to take step one is fourth year, because you are done with the prep for microbiology, pharmacology in your third year of medical school. You are done with anatomy, biochem, and physiology as well, and you're going through the special pathology in fourth year. So these are the subjects that are tested in step one. So the best time is to take it by the end of your fourth year. Uske baad, step two is all about your final year. So medicine, surgery, peds, psychiatry, and OBGYN. So the best time to take step two would be right after graduation, ताकि आपका ये सारी चीज़ें पूरी हों. But this is a perfect timeline. We did not follow this
Yeah,
timeline.
we didn't.
We didn't.
I was gonna say.
So we started for step one after our medicine rotation of house job. So basically after graduation, graduation की भी बल्कि 4-5 महीने बाद we started for our step one. So you don't have to follow. You can't say कि मैंने थर्ड ईयर में नहीं दिया तो टाइम निकल गया, मैंने फोर्थ ईयर में ये नहीं किया तो टाइम निकल गया. मैं आपको कट ऑफ बता देता हूँ. कट ऑफ के अब कितने साल अगर गुजर जाएं तो फिर it would be hard for you. If it's more than 3 years for you since graduation, तो अब आपके लिए मुश्किल होगा to match. I wouldn't say impossible.
Yeah.
I would never say impossible. I've seen people match with like after 8 years of graduation, after 9 years of graduation. But I'm just telling you about the cutoff. So about 50 to 60% programs have a cutoff of 5 years after graduation. तो अगर आपके 3 साल गुजर चुके हैं ग्रेजुएशन से, तो either you need to speed up. आप 5-6 months की prep में step 1 and 5-6 months for step 2 करके you apply before the 5-year cutoff. That is one strategy. Or what you can do is you can start earlier and क्योंकि ज़्यादातर programs का 5-year cutoff है, कुछ programs का 3-year cutoff है. So you need to take that into account.
Sorry, I'll sort this.
Okay, no problem.
Yeah, carry on.
Also, I want to add, there's a PGY2 in my program who's at least 10 years older than us. She has kids that are like 9-10 years old, and she's, so never think that it's impossible. Even if it's been over 5 years since you've graduated, although it's not optimum, but if you want to, you can definitely go ahead and, do it.
What I would say is it would be harder for a person to
Definitely,
match
definitely.
after
but
3 or 5 years of graduation. So जो young students हैं जो कि अभी सोच रहे हैं कि हमने देना है, तो they should keep in mind, okay, by fourth or final year या फिर right after graduation we can take our step one. पहले की तरह नहीं है कि you need to get a 250 on step 1 to get into the US. अब you can just pass it, but don't underestimate it. It's still a difficult exam. It is not easy at all.
After it became a pass fail, so many people started failing step 1 because they weren't preparing for it like you should
Yeah.
be. So
Because back in the
keep
day,
that in
nobody failed. Back in the day, the
Yeah.
worst possible outcome was a 210 or 220
Yeah.
on step one. Now the worst outcome is a fail.
Yeah.
So people should not underestimate it, but at the same time, keep in mind that you can, and 100% you can take the exam during your med school. So I think mistakes to avoid during prep, things to focus on. Okay. So for step one, what I've seen a lot of people make this mistake is they spend so much time on Kaplan, on boards and beyond, on watching Pathoma. Okay, Pathoma is okay, but they take up a lot of time utilizing these resources. So let's say they did all of this in like 4 months, and then they start doing questions.
Yeah.
अब प्रॉब्लम आती है कि when they start doing questions they feel like कि
They
they're
don't
getting
know.
everything wrong.
Yeah.
क्योंकि USMLE की prep is all about taking questions. You need to be a good test taker to succeed. तो उसमें यह है कि you start U world early. Things to focus on में मेरा answer is U world. Just do a system, go through a quick review from first aid for cardiology and just start U world.
Even if you haven't, like honestly, like even if you haven't read a single page from first aid, get UWorld, start doing questions, because the questions are what is going to help you make sense out of first aid, honestly. Because when I picked up first aid, मुझे कुछ समझ नहीं आ रही थी उसमें से, because it's very concise, it has points, and it's very, yeah, so it's concise. So but the questions that you're doing in UWorld, they're gonna help you make sense of it. So you should start them on day one of your prep.
एक्चुअली पीपल थिंक कि हम अगर पूरी फर्स्ट एड एक दफ़ा कर लेंगे
हाँ,
उसके
तो
बाद हम
easy.
यू वर्ल्ड स्टार्ट करेंगे तो
हाँ.
वी वुड बी गेटिंग लाइक अ 90%.
Yeah.
दैट्स नॉट द केस. यू लर्न बाय योर विद योर मिस्टेक्स. सो आपने अपनी मिस्टेक्स की हैं, आपने उस पर उसको एक्सप्लेनेशन आपने सही से पढ़ी, वाई द राइट आंसर इज़ राइट, वाई द रॉन्ग choices are wrong. तो वो सारी आपकी नॉलेज बेस बढ़ती जाएगी with every question. So even if you get like a 20% earlier on, you would improve up to 70%, 80% by the end of your prep. So always start UWorld early, especially now when step one is pass fail. So, and then testing materials for steps. Okay, so after you're done with UWorld is all about learning. It's don't use UWorld ki percentage, your correct percentage, that is
How you'll do on the
yeah,
exam. Don't
don't.
don't use it as an assessment
Yeah,
tool.
don't
Use
use
it
it
as a
as.
learning tool. It's not for you to assess yourself if you're good enough. So
तो जो टेस्टिंग मटेरियल्स हैं दे आर NVMEs. NVMEs जो हैं, जो वो बोर्ड ऑफ मेडिसिन के अपने टेस्ट्स हैं, they are used for testing. So you take these self-assessments closer to your exam. So I started my NVMEs 2 months before taking my steps. So उसमें भी आप पढ़ते हैं उनकी explanations पढ़ते हैं, and then you learn from them, and the score that you get on the NVMEs is actually quite close to what you get on the real deal. So if you're getting around 240s, 250s on your NVMEs, so you can make an average of that, and that is how your score is going to be. And especially for step 2 now, because step 2 में you need to increase your score. अगर किसी का फर्स्ट NVME में 230 आया है तो नेक्स्ट NVME में उसको चाहिए कि अपने, क्योंकि NVMEs they do tell you about your weak areas. So let's say someone is weak in biostats, he can brush up on biostats for a week and then take the next NVME. So I think there are about 6 forms for NVME. So you can take those 6 self-assessments. Okay, you want to take the next question?
yeah. So this is should I do house job or not, or should I do house job with while preparing for steps? So this is just my opinion, but I'm
latest should be mid of fourth year. And this is if you're
Sorry, I'll sort this. People just keep unmuting themselves.
it's okay.
Yeah, done.
Okay. So this is just my opinion, but I don't think you need to do house job, because one, you waste an entire year. The knowledge that you do get, if any, during house job is not really going to help you out in your step preps or even in the US, because our practices are very different here. And so I do not recommend doing house job. और अगर आपने steps देने ही हैं, but if you're confused, yeah, if you don't know whether you wholeheartedly want to do steps, तो फिर I would say okay, go ahead and
Okay, so I think इसके pros and cons हैं. Pros ये हैं कि अगर आपने हाउस जॉब नहीं की, जो कि दाओ, आगा खान, किंग एडवर्ड के बहुत सारे लोग नहीं करते, so they have that backup. They know कि okay, हमारी क्लास में से 30-40 लोग हाउस जॉब नहीं कर रहे, they are all studying for steps. तो दे सेव अ ईयर, क्योंकि जो 3 ईयर कट ऑफ है वो अब आराम से उसको कवर कर सकते हैं.
Yep.
वरना ये होगा कि आपका हाउस जॉब 1 साल हो जाएगी, नाउ यू ओनली हैव 2 years टू अप्लाई. तो ये होता है. जो कॉन्स हैं वो ये हैं कि यू डोंट हैव अ बैकअप. हाउस जॉब अगर आपने की हुई है तो यू फील लाइक यू इंटरनली यू फील लाइक ओके, आई हैव अ बैकअप, कि अगर USMLE डज नॉट वर्क आउट फॉर मी, तो आई कैन स्टिल बी इन पाकिस्तान इन प्रैक्टिस. So if so it all depends on your family situation. उनकी कितनी आपको support है, क्योंकि if let's say your family is not supportive and तो they would be like okay, इसने अभी practice नहीं कर रहा, ये किस काम में पड़ गया है. तो you need to weigh all of those pros and cons. But I feel like if you're totally dedicated, if you want to go for the USMLEs, okay, so I think I can simplify it for you. अगर आपने step 1 दिया हुआ है during your medical school, step 1, and you have passed it, then don't do house job. Just straightly वो step 2 की तैयारी start करें and then go for the US. अगर आपने step 1 नहीं दिया हुआ, now you're starting after graduation, I think house job के साथ तो prep करना is going to be hard.
That's a big no.
I think house job के
You
साथ would be
need at least 6 to 7 hours a day, and there's no way that you can put in that amount of time and energy into something when you're doing house job. I mean, some people are just, they have the superpower to do it. If you can, good for you. But personally, I would never be able to. So.
I think if you are in your house job right now and thinking about steps, तो आपको चाहिए कि फिर आप wait कर लें after you're done with your house job and then start, क्योंकि you don't want to risk it. You can't go in to the exam with half prep. So I think it's possible for young students. I think you should aim for completing step 1 during your medical school, and then uske baad just go for step 2, and that is the best strategy. Now then in that way you can match within 2 years after graduation, so you don't waste any time and you don't go through that depressive phase that you get after graduation, because after graduation studying for steps is really hard.
Yes.
because आप पूरा दिन आप सिर्फ वही काम कर रहे हैं. You have negative thoughts, you haven't done house job, you feel like okay, I don't have a backup, what am I going to do, what if my visa is not approved, what happens then? So that is how I would take this question. Ke it's a totally personalized answer for everyone. लेकिन
also because everyone has different circumstances. So अगर किसी के पास, if they're having financial issues, if they need to do house job in order to pay for their exams, I mean, absolutely go
Yes.
for it. And इसीलिए keeping into account that everyone's different, और अगर आप कर सकते हो तो फिर you can, और अगर आपको ज़रूरत नहीं है तो don't.
I think financial उस पे एस्पेक्ट पे भी मुझे एक काफ़ी डिटेल्ड उसका करना चाहिए. Okay, so I feel like for people from Wa Medical College, they have spent enough money on their medical school. So it's like they have spent itne amount in Pakistan. I feel like for your USMLEs, just take that as a continuation of your medical school. आप अगर अपने 1 साल की जितनी फीस होती है, आई थिंक इट्स 14-15 lakhs नाउ. सो अगर आप उसको एक 6th ईयर रख लें, आप कहें कि ओके 15 lakhs मैंने रख लिए हैं, इसमें आपका स्टेप 1 स्टेप 2 सम पार्ट्स ऑफ योर ऑब्जर्वरशिप आपके निकल सकते हैं आराम से. द ओनली थिंग दैट इज लेफ्ट is probably your application, जिसमें आपके another you need at least $2,000 to $3,000, which is another wo. So sometimes it goes up to, I think if you apply for 200 programs, you spend around $3,500. I think
I
$3,500.
spent, did we spent close to like 5 actually. It
Hmm?
was like 4,000 something.
Okay, so I will modify my answer. Just take that as a continuation. Okay, you need to take this as a 6th and 7th year of medical school. Okay, आपके 2 साल की, so जितनी आपने इन्वेस्टमेंट पहले 5 साल में की हुई है, अगर आप पाकिस्तान में रहते हैं तो आपको वही 70 lakhs आपको करने में, आपको इट वुड टेक यू आई थिंक about 5 to 6 years at least, maybe more. If you spend just 25 lakhs more, which is not an it's not a choti amount, it's not a choti amount, it is बहुत बड़ी amount. But if वही बात है, if you have the ability to invest in yourself, कि मैं अभी के लिए मैं लोन्स ले रहा हूँ या मैं जैसे भी कर रहा हूँ, या अगर आप कुछ लोग जॉब्स कर रहे हैं, आई स्टार्टेड विद बाय ट्यूटरिंग स्टूडेंट्स. यू कैन फाइंड इंटरनेशनल स्टूडेंट्स थ्रू रेडिट, थ्रू फेसबुक, and you can teach them. It wouldn't really um, help you to support pura ki puri USMLE journey, but a little bit of it. Some people work as medical scribes. They work and they receive income in dollars, and then they can support at least one part of their exam or one part of their USMLE journey. So financial situation पे काफी चीजें depend करती हैं.
And
लेकिन
it's
वही
very
बात है,
sad
and
as
it's
well.
and
It
it's
shouldn't
actually
be like this. This is very sad, but this is the truth and the hard reality of our society that we live in.
I think you also have to compare it with the US students. They are in debt of like hundreds and thousands of
A
dollars.
lot to be where they are.
तो उसके हिसाब से अगर आप देखते हैं तो it's very minimal for someone from Pakistan, जो कि काफ़ी कम में he is studying for his medical school, and उसके बाद he is going for the steps in USMLEs. Okay.
I would once again like to make some comments here. Obviously, it's an expensive journey, there's no denying. लेकिन चीज़ों को ना, obviously जब आप medical student होते हैं या fresh graduate होते हैं, तो आपकी वो वाली approach नहीं होती in most circumstances कि आप थोड़ा ना futuristic होके सोचें. अगर आप आज पाकिस्तानी 30-40 लाख रुपया एक पाथवे में लगा रहे हैं ना, तो आप देखें कि इसका एंड पॉइंट क्या है. अगर आप 3 इयर्स की इंटरनल मेडिसिन की या पीडियाट्रिक्स की या साइकाइट्री में यूएस में रेजिडेंसी कंप्लीट करते हैं एंड देन यू बिकम एन अटेंडिंग फिजिशियन, ठीक है, एंड ऑब्वियसली द सैलरीज वेरी फ्रॉम region to region, from state to state, that's a given. But in general, if you take an average of those variations, the amount of money you will make after you become a top-notch physician in that specialty, I think, correct me if I'm wrong, you guys, I think you can easily cover up all the expenses.
Yes.
Is that right?
You can cover up your USMLE expenses in 2 months at least. At max, I'm saying 2 months of your residency salary can cover up your USMLE step 1, step 2, all of your expenses during the observership match process. And ऐसी कौन सी investment है आजकल in I think in Pakistan that gives you that return. तो आई फील लाइक अगर आपने 70 lakhs तक लगा दिए हैं ऑन योर मेडिकल स्कूल इन पाकिस्तान, अब to recover that in Pakistan, if you're staying there, is going to be hard. It's going to be impossible for young grads with the job situation in Pakistan. People are doing unpaid training. People are working in extremely um, insane working conditions, and they are still not getting paid. So तो इससे तो just invest those 20-25 lakhs more. It's going to be hard pill to swallow at first, लेकिन ये है कि in the long term this is going to be a huge investment for you, for yourself and for your family. I think I have a question आगे, लेकिन मैं इसको अभी address कर देता हूँ कि किसी ने पूछा था, if you are a couple who is matched in the US, how much money can you save to send back home? I feel like every month, if you are in a reasonable, if you are in a reasonable state, like not like in main city New York or California, you can easily send home about $800 to $1,000 back home, which is about 3 lakhs per
But
month.
also specify this is during residency, or residency mean your pay is a lot. It's like a fraction of what you make
As an attending, of course, of course.
So as an attending, you're making
As an
बहुत
attending,
ज़्यादा।
you can send उससे बहुत ज़्यादा.
बहुत ज़्यादा
In
भी
Pakistani,
नहीं
you
है।
can Pakistani terms, you can send at least 8 to 10 lakhs back home, which can be huge for your family each month. तो आप इसको इन्वेस्टमेंट के तौर पे देखें. अभी जो आपके 20-25 या किसी सिचुएशन में आजकल ड्यू टू इन्फ्लेशन 27-28 lakhs लग रहे हैं ऑन योर USMLE जर्नी, within 3 to 5 years, inshallah, you can easily change your family's condition, your own condition. You can have a great life in that sense in terms of salary. So I feel like financial situation. लेकिन of course ये मैं उसी बंदे को कहूँगा जिसके पास 25 लाख हैं at the end of graduation, जिसकी फैमिली के पास हैं to support him through it. अब मैं उसको नहीं कहूँगा जिसके पास नहीं है. Of course it would be harder for him. He would have to do multiple jobs. He would have to work in yeah, it would take longer for him, but of course you can take up a job in the US, कोई remote job, दिन में आप काम कर रहे हैं, साथ पढ़ाई भी कर रहे हैं, तो इस तरह you can support yourself. So it was a detailed answer for that. So, but I think this is an important question for everyone. Um, okay, I think we took this one.
Yeah.
Okay, so timing for applying for the visa after step 1 or after step 2. Okay, so अच्छा मैं आपको बताता हूँ वीज़ा सिचुएशन इस तरह होती है कि for observerships you need a visit visa which is a B1 B2. द आजकल पाकिस्तान में वीज़ा अपॉइंटमेंट का जो वेट टाइम है दैट इज़ 1 year to 1.5 years. सो अगर आप आज अप्लाई करते हैं फॉर द US वीज़ा, आपकी अपॉइंटमेंट आपको मिलेगी नेक्स्ट अगस्त की. तो लोगों की गलती ये होती है, लोग करते हैं कि ओके मैं स्टेप 1 पास करूंगा, मैं स्टेप 2 पास करूंगा, उसके बाद मैं वीज़ा अप्लाई करूंगा. सो व्हेन दे डू दैट दे रियलाइज कि ओके ये तो मुझे तो 1.5 साल इधर लग जाएगा. व्हाट एम आई गोना डू? मैंने तो हाउस जॉब नहीं की, मैंने तो सिर्फ एग्जाम्स की प्रेप की है और वीज़ा मुझे नहीं मिल रहा. तो आजकल के उसमें ऑलवेज अप्लाई फॉर वीज़ा अर्ली. राइट बिफोर ग्रेजुएशन इज़ अ गुड टाइम टू अप्लाई. यू स्टिल अ मेडिकल स्टूडेंट, आप उनको शो कर सकते हैं कि आई एम स्टिल अ स्टूडेंट, आई विल कम बैक आफ्टर माई ऑब्जर्वरशिप्स. तो आई थिंक यू वांट ऐड समथिंग.
No, I think this is it's
आई थिंक सो मैं अगर इसका बताता हूँ कि DS-160 इज़ द फॉर्म दैट यू फिल फॉर योर B1 B2. DS-160 फिल करने के बाद यू पे द वीज़ा फीस एंड उसके बाद यू सेलेक्ट योर अपॉइंटमेंट डेट. अपॉइंटमेंट डेट 1 साल बाद की मिलेगी. इतने टाइम में आप अपनी बैंक स्टेटमेंट प्रिपेयर करें, आप अपनी ऑब्जर्वरशिप्स की डिटेल्स आपके पास होनी चाहिए.
schedule them because they take a year
हाँ,
in advance.
क्योंकि
like,
ऑब्जर्वरशिप्स
yeah,
आपको दिखानी पड़ेंगी उनको.
you have to
यू वुड
schedule
हैव
them
टू
a
टेल
year.
देम कि आप कौन सी जगह पे जा रहे हैं, कितने दिन के लिए जा रहे हैं, कौन सी रोटेशन है, किस हॉस्पिटल में है, इन पेशेंट है, आउट पेशेंट है. इफ़ यू आर प्रिपेयर्ड, you most likely you would be approved. Some people also use USMLE step 3 क्योंकि USMLE step 3 is only can only be taken in the US. So some people say okay I have to go for USMLE step 3 so I need the visa. तो most लोगों का approve हो जाता है. In my personal experience the approval rate is about 60%. So I would say 2 out of 3 get approved. अभी मेरे जूनियर्स में आई वाज टॉकिंग टू अ फ्यू पीपल, 2-3 का अप्रूव हुआ है, 1-2 का रिजेक्ट भी हुआ है. सो इट्स काइंड ऑफ 60%. लेकिन द बेस्ट टाइम टू अप्लाई
Is now.
is now.
Is now. Because it's gonna take a long time. So jitna in advance that you can apply, go for, even if it's before your if you've started preparing. So sabse pehli cheez that you could do is apply for a visa.
हाँ, अप्लाई फॉर द वीज़ा राइट अवे. अभी जो आप एप्लीकेशन भेज रहे हैं उसमें वो आपसे कोई डिटेल्स नहीं पूछेंगे. दे डोंट इवन नो दैट यू आर वेर यू आर वर्किंग, व्हाट आर योर एस्पिरेशंस. वो सब कुछ पूछेंगे आपसे ड्यूरिंग योर इंटरव्यू. तो अभी आपको चाहिए अप्लाई करें. इन द मीन टाइम बी डन विद स्टेप 1 एंड स्टेप 2. एंड जैसे ही स्टेप 2 होता है तो आपका इंटरव्यू अपॉइंटमेंट आपके पास होगी और इंशाल्लाह अप्रूव हो जाता है. तो you can go straight for your observerships and you can apply in the same match cycle. So that is the situation for visa. Okay. Research or observerships? What matters more?
Observe.
100% observerships. Observerships की बेसिस पे ही आपकी सीवी बनती है. आपकी सीवी में पता होगा कि आपने किस डॉक्टर के साथ काम किया है, किस जगह पे काम किया है, आपने किस तरह की आपकी रोटेशन थी, व्हाट एक्सपीरियंसेस डिड यू व्हाट मीनिंगफुल एक्सपीरियंसेस डिड यू गेट ड्यूरिंग दैट इन पेशेंट और आउट पेशेंट एक्सपीरियंस. तो आपको 100% ऑब्जर्वरशिप. रिसर्च इज समथिंग दैट हैज़ बीन हाइप्ड अप. आई हैड रिसर्च, but I feel like I have along मेरे प्रोग्राम में I know a lot of people who match with zero research. बट ऑब्जर्वरशिप्स आर 100% मोर इम्पॉर्टेंट. आपको ऑब्जर्वरशिप के बगैर आपको मैच होना बहुत मुश्किल है. एंड ऑब्जर्वरशिप इज़ द टाइम जिसमें आपके पैसे ज़्यादा लगने स्टार्ट होते हैं, बिकॉज नाउ यू नीड टू ट्रैवल, नाउ यू नीड टू बी इन टेक्सास फॉर अ मंथ, यू नीड टू स्टे देयर. उसके बाद आपने शिकागो जाना है, उसके बाद आपने न्यूयॉर्क जाना है, तो उसमें आपको पैसे काफ़ी लगेंगे.
Touch on telerotations, because if you are not able to go to the US physically, if you don't have that kind of money to travel and live in certain places for a month or two, you can always do telerotations. And if they don't count as much as a physical rotation, there's still something. I mean, you can definitely go in and apply with just telerotations.
Tele rotations are kind of 50-50 in the sense okay, you do get a good letter of recommendation. You do learn, you do have a good passive experience of the US healthcare system, but it depends on what your scores are. क्योंकि अगर आपके scores कम हैं काफ़ी, and then you are only doing tele rotations, then it would be harder for the programs to actually assess your application. So if you have good scores, then you have a visa situation जिसमें आपका reject हो गया है या you don't have any other option, you can go for tele rotations and take a chance. तो ये सिर्फ उन लोगों के लिए है जिनका वीज़ा रिजेक्ट हुआ हुआ है,
या कोई मसला है
या
या
कोई
कोई
मसला है.
financial situation है in which they can't make it. I still think it's a very I think it's a very good option for अगर आप उसी साल apply करें, you're gonna go in without anything, go in with telerotations, please, because that will boost your chances of getting so many more interviews.
I would slightly differ. I would say कि only do this if you have a poor visa situation. फाइनेंशियल सिचुएशन में आपको चाहिए कि किसी तरह, बेशक आपने अगर आप स्टेप 1 स्टेप 2 कर लिया है, टेक अ लोन, डू व्हाटएवर, बट डू इन पेशेंट रोटेशंस. आई वुड सजेस्ट दैट, बिकॉज आपने आगे भी इतनी प्रोग्राम्स में अप्लाई करना है. यू कैंट रिस्क इट विद जस्ट टेली रोटेशंस. यू शुड ओनली डू इट इफ यू हैव a visa situation which is and you find it harder to apply this year and you don't have a visa in hand, तो उस situation में आप apply करें with tele rotations. Okay, how to find observerships? Okay, you want to take this one?
This is very difficult. I think I mean, I'm gonna address and then you can add. You have to be in touch with your seniors and other people, like Ahsun said. You have to get in touch with people from other medical colleges and just send out either mass emails, in which most likely sometimes you don't get responses, but then there's also there's resources on the internet like spreadsheets and stuff which which list the programs that do offer observerships, and you can contact them, but do it like a year or so in advance because they're usually really booked. So if you're finding them on your own, you have to use spreadsheets and resources from the internet. But if you have connections and if you know doctors in the US, like not residents, but like attendings and stuff, then then it's a lot easier because you can ask them and they can connect you with people who are willing to let you observe with them. So it's
Okay, for observerships, I think the first category is electives, जो कि बहुत कम आजकल मिलते हैं, and electives are expensive. Electives are only at universities. So if you want to save that money, just do observerships which are after graduation, and you can work with कोई आपका जानने वाला who has a private practice. You can work with them. You can message or email attending physicians in the US के can I rotate with you. Apna, which is American Pakistani Physicians Association, they have this observership I think application every year. They do it twice a year. They take in about 50 to 100 students every year, and which is free of cost. You don't have to pay a lot. तो आप इस तरह की चीज़ें हैं to do that. I think a couple of my juniors have recently rotated in Texas, and they had a good experience. So I feel like you can connect with them as well. क्योंकि कुछ लोग होते हैं, कुछ एरियाज़ हैं, जिस तरह ह्यूस्टन मेथोडिस्ट है। अभी यासिर सत्तार भाई वाज टेलिंग मी इन अ ग्रुप दैट वेस्ट वर्जीनिया यूनिवर्सिटी आल्सो हैज़ एन ऑब्जर्वरशिप प्रोग्राम। इसी तरह बहुत सारी यूनिवर्सिटीज़ हैं, दे हैव दीज ऑब्जर्वरशिप प्रोग्राम्स यू कैन, बट कुछ की विच सम ऑफ देम आर पेड, सम ऑफ देम आर फ्री। You just need to look out for them, look for them on your own actually. तो थोड़ा सा डिफिकल्ट प्रोसेस है, but start during your
Yeah, carry on. Oh, yeah, carry on. Sorry.
no problem. अच्छा, तो but start early, start during your step 1 prep. आप साथ साथ पढ़ाई कर रहे हैं, साथ साथ look for observerships, साथ साथ keep emailing physicians, keep looking for them. और जिस time, by the time you get a visa appointment, you can show your observerships, you can show your letters, okay, I have to go see, I will rotate with this doctor for the month of June, let's say, and then you can go for them. So यहाँ इस part of the residency match process में you need guidance, and अगर आपके अच्छे seniors हैं who are in good positions, they could be from any college and you can take their help, and most of them are usually very supportive and helpful. So so इस तरह observership, and last resort is getting a paid observership. अगर किसी को कुछ नहीं मिलता, किसी को कोई physician से भी उसका contact नहीं होता, there are some agencies which cost a lot. They cost about $1,000 to $1,500 for a 4-week rotation, which is a lot. But that is the last resort. अगर आपको कहीं से कोई free physician नहीं मिलता, कोई और contact नहीं मिलता, तो you go for those agencies. But I would suggest that that should be your last option. Okay. Okay, surgery match is possible or not? Surgery match is possible, but it is going to be harder, because harder in the sense, step 1, step 2, you're done with that. You need a good score, obviously, but now you need to find observerships in surgery. Observerships आपको surgery में मिलनी काफ़ी मुश्किल हैं, क्योंकि those are inpatient. The surgeon is liable for getting a foreign student in without any background, and so they are kind of hesitant to bring a foreign graduate in for an observership. But इस situation में your seniors matter a lot. जिस तरह आगा खान में they have a huge alumni, surgeons की जिनकी वो है, and इसी तरह काफ़ी और भी वो हैं competitive specialties.
Yeah, exactly. And all the competitive specialities, if you're interested in them, इसके लिए the biggest thing is the research year that we talked about पहले. कि अगर आप वो research year कर लेते हो at a university, then your chances of matching into your competitive specialty increase a lot. So अगर आप 1 साल या 2 साल, like let's say surgery या something like orthopedics, these are very, very competitive, and you're gonna have to do 1 or 2 years prior to applying in the math cycle. You're gonna have to do 1 or 2 years of research.
I think I would simplify it for you कि एक internal medicine के लिए match होता है जिसमें you are done with step 1, step 2, 3 months of observerships, and you can apply for the match. For surgery, for orthopedics, the route is different. उसके लिए होता है you're done with step 1, step 2. Now your research year is very important. People who have matched in neurosurgery, orthopedics, they do a complete unpaid research year at a good university. I've seen people at Northwestern University, Duke, a University of Chicago. तो वो उधर एक अनपेड रिसर्च ईयर लगाते हैं, विच इज़ अ ह्यूज इन्वेस्टमेंट, जो अब आपका फाइनेंशियल सिचुएशन बहुत ज़्यादा चेंज हो जाएगी। अगर आपको इंटरनल मेडिसिन में मैच करने के लिए अगर आपको 25 लाख चाहिए, आपको सर्जरी में मैच करने के लिए एटलीस्ट फिर आपको 80 लाख के करीब चाहिए होंगे, क्योंकि यू नीड टू you need to do all of your expenses for a year being unpaid in the US. तो जो लोग उस तरह करते हैं, I have a friend who is at Aga Khan. He wants to go into surgery. He is doing 2 years of research at University of California, and अब वो बहुत बड़ी इन्वेस्टमेंट है. He is done with medical school. Now he's spending 2 years there being unpaid. And then he would apply for the match. उसमें फ़ायदा ये होगा कि you would have research publications during those 2 years. You would have great letters of recommendation during those 2 years. You would make connections within that university with surgeons, and that is going to help you a lot. तो बहुत मतलब मुश्किल है, not impossible. Depends on how motivated you are to get into surgery. If you're like, okay, मैं surgeon, I don't see myself as anything except a surgeon. So then you have to go through this.
Also, you can also get a paid year of research, but that is very rare and that is very, very difficult. और ये तभी होता है जब you have strong connections. If you have really, really strong connections, they can even get you a
I
paid
think
year
that
of
that doesn't
research.
happen
That
right
doesn't
off the
happen
bat.
very often.
Yeah,
हाँ.
that usually happens. Okay, you start a research year for a specialty, and then आपने 4-5 महीने काम किया, and then they see, okay, you're doing really well, and then they can turn your unpaid research into a paid research. So that can help you get hold of some of your expenses. Okay.
Once again, I would like to add on a few comments. If you think that you are a kind of a person जिसे practical procedures करके, invasive procedures करके professional satisfaction मिलती है, इसलिए वो आप सर्जन बनना चाहते हैं, क्योंकि आपको practical procedures करके, invasive procedures करके clinical satisfaction मिलती है as a clinician. So what I would suggest over here is कि some specialties of internal medicine, उनमें अब practicals अब बहुत ज्यादा आ गई हुई हैं, ठीक है. उसमें नंबर 1 है कार्डियोलॉजी, नंबर 2 है गैस्ट्रोएंट्रोलॉजी, and obviously respiratory medicine, critical care medicine, intensive care, ठीक है. उसमें बहुत practical procedure है. So just because you are a very practical procedure oriented person doesn't mean that surgery is the only thing out there. No, you can come into internal medicine, ठीक है, शुरू के 2-3 साल जनरल मेडिसिन है, मे बी आपको इतने प्रोसीजर्स करने को ना मिले, लेकिन व्हेन यू गो फॉर फेलोशिप ईयर्स लाइक कार्डियोलॉजी, रेस्पिरेटरी, उसमें फिर आपको बहुत कुछ करने को मिलेगा. तो there's always an opportunity to explore other options as well.
Thank you for adding this, Hussam
I was
bhai.
going to say
Because
this.
I feel like in Pakistan you don't have exposure to those specialties. You don't have exposure to interventional cardiology. You don't have exposure to invasive gastroenterology. So यहाँ पे लोगों को इतना पता नहीं होता, मुझे भी नहीं पता था कि you can get into those specialties and be hands-on, and you can do procedures, you can make a lot of money. That is going to be a 6-year process for your training, but that is going to be amazing for your career. If you can get into those interventional cardiology or gastroenterology specialties or in fellowships, that is amazing. So, and that is what most people do. वो लोग पहले 3 years internal medicine करते हैं, फिर 2 to 3 years cardiology करते हैं, and then that another extra year for interventional cardiology, and that is the closest you can get to surgery with internal medicine की flow chart में. That is the closest you can get to surgery, and which is and that is much much easier than getting into surgery. So okay, filters for the matching process. Okay, so there are 4 to 5 filters. Number 1 is year of graduation. I think most programs want people to be within 5 years of graduation. Some programs want you to be within 3 years of graduation. ओके, दैट इज द नंबर 1 फिल्टर. अब उसमें मैटर नहीं करता कि आपने कितना आपका स्कोर है, कितनी आपकी ऑब्जर्वरशिप्स हैं, कितना आपका पाकिस्तान में स्पेशलाइजेशन का एक्सपीरियंस है. इफ़ यू आर नॉट इन दैट 5 ईयर कट ऑफ, आपकी एप्लीकेशन हो सकता है उस प्रोग्राम के पास पहुंचे भी ना. You apply for that program, but when they use that filter, your application would be out of the picture. So year of graduation is a big filter. Scores are the second biggest filter. Some programs actually most programs want you to pass in the first attempt. So that is the lowest filter they can get. Second filter would be 220s or 230s.
I've even seen like 240s for some.
I've only seen like 240
Yeah.
once, I think.
Oh, and
Once
I
or
saw a 250 once as well, which was crazy. There's a filter of a program which was like 250 cutoff.
I think that's Western Michigan
Yeah.
University.
Yes.
who have a filter for 250.
Yes.
But that is not the norm. That is like
Yeah, that's not
that is a
normal.
skewed
Yeah.
distribution,
Mhm.
because usually it's 20 it's about 220, 230 is the filter usually.
Mhm.
So that means you are still in the game.
Mhm.
Third biggest filter would be observerships. Most program would be like, okay, we need 3 months of observerships. अगर आपकी 3 months नहीं है, आपकी 1 महीना है, 2 महीना है, तो I think your application would be filtered out. What else? Do we have another filter?
I think these are the major
These are
filters
the major ones.
that actually matter. If there's a program out there that's, considering something outside of these, then it's their issue.
Yeah.
Problem. So
Actually,
these are
when
the
you're
main
applying for the programs, you have to go through their individual websites, their
Yeah.
application requirements, and then apply tactfully.
Mhm.
Don't apply to 250
Yes.
programs without actually going through their websites.
Yeah.
So if you see a program which says that we need 6 months of observerships, just don't apply to that
Mhm.
program. That is not going to be a place that you want to be anyway. So so programs that have very strict cutoffs, like 1 year after graduation, 250s, 6 months of observership, they are very, very rare. And they are usually non-IMG friendly. So just save your money and don't apply to
Yeah,
them.
and I'm gonna talk from experience, because there was this program in Michigan that I really liked. And I met everything except for their observership criteria, because they required 4 months. I had like 3 months. And I ended up applying anyway, and I even wasted a signal on that program. And then later I found out that, that program sent out interviews to people with much lower scores, and, but they just had more observerships, and I wasted a signal.
Okay,
So don't do
so
that.
you mentioned signals. Okay, so
Yes.
signals are something that they have introduced in the past. I think last year they introduced it last year.
Mhm.
So you apply to 170 programs, let's say. Now you have 7 signals.
Mhm.
Signals are like, these are my top priority, or these are the programs that I want to go to.
Mhm.
So when you signal a program, you just don't waste your signals
Yeah.
on big name programs. Let's say you signal Harvard, Columbia, UCLA.
Don't do that.
Don't do
Yeah.
that, because then you're not going to because so many people have signaled them.
And
Signal,
American grads,
yeah.
and that is what they prefer as
Yeah,
well.
so signal good university affiliated programs, good community programs, so that the program knows that this guy actually wants to come here.
Yeah.
He is not going to rank us lower in his own list. So because programs don't want to go unfilled anyway, so they want you to rank them high. Okay, so pathways for ECFMG certification. So I think this is also something that people don't understand. So after you're done with step 1, step 2, your OET, now you need to be ECFMG certified. There are some, पहले होता ये था कि you had another exam, step 2 CS, which was a clinical skills program. अब वो cancel हो गया. So there's no step 2 CS. उसकी जगह they have introduced these pathways. Pathway 1 is you have done house job or you can practice in your country. Pathway 2 is you have graduated within 2 years of graduation. Pathway 3 जो कि अब introduce हो गया पाकिस्तानियों के लिए, because
Which is good.
PMDC is now registered with WFME. So you can apply through pathway 3 and just be done with it. So pathways are only to get ECFMG certification.
And you don't need house job. I do.
And you don't
Yeah,
need house job for this.
Last year, up until last year, and the years before that, I
It's
mean,
not,
people were
you
more
weren't.
confused that whether they should do house job or not. But you can comfortably even skip house job, because you have a pathway that protects you, even if you haven't done house job.
So basically these are just pathways. सब कुछ ECFMG की website पे लिखा हुआ है. I don't have to tell you हर चीज इधर, because it will take a lot of time. All of these pathways have their own requirements, and you just go through that electronic process. Okay, so किसने लिखा है? Route for couples who don't have connections in the US. Okay, so for couples who don't have connections in the US, I feel like a lot of people match without
Without
connections,
connections.
to be honest.
Anyone who's telling you that you need connections to match,
I mean,
you don't.
you need connections to to do
Better-
observerships,
better
probably.
opportunities, you would have better opportunities than a person who doesn't have connections, but majority of people match without having any
Because people
connections.
think connections, if let's say I know someone, a friend of mine who is at a hospital, people think that connection is going to get me an interview.
Yeah, and it
That connection is going to get me ranked at that program. That doesn't happen. Connections help you to get into the system, I guess, observerships. लेकिन अगर किसी के पास बिल्कुल कोई connections नहीं है, you can create your connections. You can go into these groups. You can talk to people. You can be friends with those people. You can email them. Just create connections if you like. आपको उससे काफ़ी help मिल जाएगी. तो इस तरह आपको पता लग जाएगा कि लोग किधर ज़्यादा ऑब्जर्वरशिप्स करते हैं. आपको आइडिया हो जाएगा. Just create those connections. Nobody is born with those connections.
So I would like to make a comment here. All the audience who belongs to Wah Medical College, I want to make it very clear that you cannot say that we don't have connections in the US. You have. The alumni of the US is lovely. I've invited so many people on my platform, including today. None of them said that I don't want to help my fellow students of WMC. So you have connections, yeah? Okay.
And that helps you a lot. I remember Hassan bhai se, Dr. Hassan bin Arshad, he reviewed my CV a couple of times. He gave me like brutal suggestions ke pehli dafa he completely nailed my CV. Ke you haven't done this right, you haven't done this right. And of course I took his advice, and thankfully I did, because क्योंकि that gave me an idea ke, because Hassan bhai was he was a resident. He knew how programs filter applications, how they how they actually see an application. तो वो सारी चीज़ें मैंने उसी तरह की, and alhamdulillah I did. इसी तरह साथ वासिक भाई, thank you so much if he is watching, कि he took mock interviews. मैंने उनको I think 2 दफ़ा इंटरव्यू दिया. He gave me good feedback. He told me कि तुम्हें अपनी लाइटिंग सही करनी चाहिए, तुम्हें ये करना चाहिए, how should be your posture, तुम्हें कौन कौन से questions तुम्हें उनके answers पता होने चाहिए. So Talal bhai, he reviewed my personal statement. So you create those connections. You can't be a lone wolf saying कि okay मैं सारी तैयारी खुद करूँगा, मैं खुद observership ढूंढूंगा, सब कुछ खुद करूँगा because I am good on my own. You can't do that, and it would be really hard if you are that kind of person. So
rely on other people, ask them for help whenever you need it, and everyone's here to assist you. Even if we can't get you something, like let's say if you're asking us for an observership and we can't do that for you, because let's just say we're just residents at this point, we can still guide you in ways and let you know of things that you wouldn't know on your own or from other groups. Or I mean, there's still a lot of information on groups, but like do reach out to your alumni because they will help you.
do your personal research first.
Yes.
पहले you go on Google, Facebook, YouTube, Reddit, Twitter, all of LinkedIn. All of these are great resources for you to research. You can't come to you can't message someone who is so senior, asking him for okay मुझे जो है वो
Resources
मुझे
बताओ.
resources बताएं कि कौन से हैं, क्यों, because these things you can just look them up on Google. You should, for connections, ask them questions that are not on Google, that are not on Facebook, so that the other person also knows that you have done your homework and now you're asking a specific question.
That you're serious about what
Yes.
if you want to know, because there would be a lot of people that are like, oh, we need can you tell us about the resources, or these are very basic things that you can do on your own. After, if somebody comes to us and says, okay, I have this or I'm doing this, how do I go about preparing or doing that, is when we can help you out more, because it's like telling a person कि अच्छा you need first aid, you need world, you need to look at Kaplan videos, ये सारी चीजें सबको पता होती हैं and you should know them.
And I feel like कि a senior कोई बंदा also likes it when the junior guy has done his homework and he asks you, okay, I'm done with 80% U world, I am getting 50%. When should अभी कुछ specific question है, he knows कि अच्छा ये बंदा dedicated है, Not like someone who hasn't done anything is just asking you a question के मैंने जो है मुझे किस तरह करना चाहिए और क्या करना चाहिए. I feel like
या फिर asking इस तरह के questions when let's say you haven't started preparing for anything या आपको resources भी नहीं पता and you just come up with, oh, how much money will you make or how much yeah, okay, so what is your lifestyle going to be like? I mean, we don't want to entertain इस तरह की चीजें.
I mean,
I mean, we would
I do
obviously,
answer, I do
yeah.
answer everyone. Everyone who messages
Yes,
me, I try
I
my
do
best
too.
to
I
answer
do
them.
too.
But it's just that you should do your homework first.
Mhm.
You can't go in half-heartedly. आपको होना चाहिए कि ओके अगर मैं डेडिकेटेड इनफ हूँ अब मैं कर सकता हूँ अब मैं अब ये सवाल कि क्या यूएसएमएलई मुश्किल है इज नॉट गोइंग टू हेल्प यू ओके मैं क्या कहूँगा कि अच्छा मुश्किल है या आसान है हाउ इज दैट गोइंग टू चेंज योर पर्सपेक्टिव ऑन दैट
हाँ.
तो आप थोड़ा इंटेलिजेंट क्वेश्चंस करें विच आर नॉट ऑनलाइन एंड देन यू आर आस्किंग समवन ओके
But then again, I also don't want people to think, oh, हम approachable नहीं है. Please, please, if you guys
I
have
don't want to
even,
discourage
if
anyone.
you even have any, don't think any question is dumb. If you need any sort of guidance, even if it's on resources, like I'm negating myself, but if you need any help, please do reach out to your
Yeah.
seniors.
लिटिल एडिशन है जब भी आप अप्रोच करें अपने सीनियर्स को जो कि बाहर मुल्कों में पाकिस्तान से बाहर रेजिडेंट हैं प्लीज टेक इनटू अकाउंट अबाउट द टाइम डिफरेंसेस ठीक है तो मुमकिन है कि अगर आपके दिन का टाइम है तो उधर रात का टाइम और मुमकिन है जब आप जागे हुए हैं तो वो सो रहे हैं तो एक जो बेसिक एटिकेट होता है ना कि आप पहले हमेशा मैसेज करें रादर देन मेकिंग अ डायरेक्ट फोन कॉल पहले हमेशा मैसेज करें मैसेज में अपने आप को इंट्रोड्यूस करें कि आप हैं कौन आपका नाम क्या है आप किस बैच से हैं वहां मेडिकल के और फिर आप अपना क्वेश्चन पूछें ठीक है और हमेशा एंड में ये लिखें कि लुकिंग फॉरवर्ड फॉर योर रिस्पॉन्स वेन एवर यू आर फ्री ठीक है क्योंकि मेरे साथ अनफॉर्चुनेटली क्योंकि मैं बहुत एक्टिवली इन्वॉल्व हूँ इस बिजनेस में फॉर द यूके पाथवेज तो अगर मैं अपने ऑन कॉल अब जिस तरह मैं रात को मैं नाइट शिफ्ट कर रहा था मैं लिटरली घंटा पहले उठा हूँ इस प्रेजेंटेशन से पहले ठीक है तो मेरा बहुत बिजी स्केड्यूल होता है तो अब कभी कभी हो जाता है कि मैं अपने जूनियर कोलीग्स को वहां मेडिकल के स्टूडेंट्स को डॉक्टर्स को ना बहुत टाइमली रिस्पॉन्ड नहीं कर पाता ठीक है तो आगे से रिस्पॉन्स आ जाता है कि आई एम वेटिंग फॉर योर रिप्लाई व्हेन आर यू गोइंग टू रिप्लाई सो दैट साउंड्स अ बिट एग्रेसिव या तो ठीक है तो अगर आपने अपने किसी सीनियर को अप्रोच करना है ना यू हैव टू टेक दीज फैक्टर्स इनटू अकाउंट के टाइम डिफरेंसेस हैं उनकी अपनी बिजी स्केड्यूल है वो बहुत सीनियर है और बहुत एडवांस्ड है अपने करियर में so whenever he will get time he or she will respond so I just have to show some patience.
Yep. Okay, so the next question is actually quite important for WMC students. What are the documents that are required from WMC for your residency match application? Okay. So number one is your MSPE, which is your Medical School Performance Evaluation. Don't trust the student affairs department to write all of this for you. क्योंकि there would be mistakes, there would be grammatical mistakes, they would not follow the template. आपको चाहिए कि खुद जाएं प्रूफ रीड करें. I personally met Dr. Musarrat Ramzan. She's our dean. And she was very welcoming. She actually helped us get in touch with the student affairs department. And then मैंने उनको सारा खुद से बताया कि किस किस जगह पे क्या आपने लिखना है student affairs को. And then the dean actually wrote her a letter of recommendation at the end of MSP and signed it. तो MSP is actually a very good document. उसमें आपकी सारी profs के scores होते हैं, आपकी overall performance होती है, extra curriculars भी आप add कर सकते हैं. But it is a good document in the sense कि this is an important document. आपकी application is not complete without this document. लेकिन अगर आपके कोई supply है, अगर आपके कुछ low scores हैं, तो आप ये समझ रहे हैं कि अगर उसमें आ गया तो मेरी application बहुत hurt हो जाएगी. That is not going to happen. I've seen so many people who have matched with the failed professionals and with low scores. So it does not matter. It is just a required document. You can't match without this document. So this is MSPE, or you can call it the Dean's letter. Second important document is the IMSEL, which is Internal Medicine Structured Evaluation Letter. So you get this from the head of Department of Medicine. So this is really important for internal medicine. अगर आप PEDS या किसी और department में किसी और field में apply कर रहे हैं तो I don't think this is of value. Lekin for internal medicine, again, I talked to Dr. Muzammil, who is our head of department, and he actually wrote me a good letter, and structured in the sense they have a lot of questions. They are multiple choice questions. कि इस बंदे की परफॉर्मेंस कैसी थी ड्यूरिंग हिस्ट्री टेकिंग, क्लिनिकल एग्जामिनेशन, क्लिनिकल स्किल्स, knowledge base कैसी थी. So you can just tick through all of those, and usually you make life easier for your head of department, and just ask him to proofread stuff, and if he wants to add something you can do that. But the key issue here is that you cannot upload that IMSEL yourself. That needs to be uploaded from Dr. Muzammil's account. So that letter of recommendation is actually uploaded from Dr. Muzammil's account. He can, it's up to him. You can just request him. You cannot say कि मैं आपको लिख के दे रहा हूँ and you just upload it. So you ask him, request him, and if he actually says okay मैं करता हूँ, so then he can upload it, or then he can ask his staff to upload it. You can help them out, but don't pressure them to do that your way. और बाकी एक और कौन सा डॉक्यूमेंट चाहिए हमें?
These
IMSEL.
are the two,
These are the
oh,
two
and then
major
your
ones.
transcript, obviously.
Oh yes, your
Your
transcripts.
transcript.
Your medical school transcripts are really important.
Mhm.
I think they are uploaded by the school itself.
Yeah,
Yeah, so
I think that goes in during the ECFMG
yeah, I think during the ECFMG process,
process.
you ask your student affairs department and they would upload everything electronically, so you don't have to worry about that. They just take a lot of time, so you have to call them or email them or just go there personally. तो थोड़ा उनको पुश करना पड़ता है, but usually from my perspective, I think student affairs department was they were approachable. They took their time, but they were approachable. So and dean and the head of departments, they were very welcoming, so I'm glad.
I think, yeah, if you are applying, I think you should go in person and meet the dean or any
I think
personally. Like doing it over the phone or
it's
emailing
not
them
going
is
to.
not going to be effective. They're probably not even going to look at it. Like if you just email student affairs, they might just not look at it. So you need to go in person and talk to them. Because
So
these are very important documents that you need to get done before the match process.
I think it's better if you are in Pakistan, and then whenever you during your step 2 prep, just ask them and go there personally to meet them,
Mhm.
and then get that document done. As compared to you are in the US, now you're trying to get hold of that document, you're calling them,
It's
you're
very
email them, it is
difficult.
going to be very hard.
Mhm.
And at that time people are like, okay, हमारी application की deadline is in September, I don't have the MSP, I don't have the IMSEL, the student affairs department is not responding, and then they get those are anxious times.
Yeah.
So prepare beforehand. If your application is in September, try to prepare all of these documents by May, June at least.
Yeah,
By May, June.
absolutely. Mhm.
So, okay. I think the last question is about the interviews, and then I'm done, and then we are going to take questions from the chat. Okay, so how was the general interview process? Do's and don'ts. What, how did you prepare for those interviews? And a typical day. Okay. And how did you research your programs? Okay.
Oh,
So,
that's
mhm.
yeah.
So interviews are very they're comfortable, to be honest.
Yeah.
The programs are not trying to pimp you, or they're not trying to ask difficult questions. Most of them are just talking about your own personal stories, your
Mhm.
extracurricular activities, your ambitions. Why are you applying to internal medicine? Why are you applying to our program?
Mhm.
What association do you have with our city or state,
Mhm.
or what can you give back to the community? So if you research, so your research about that program is really important. अगर आपका कोई program is a big university, तो आपको उसके मुताबिक उसकी रिसर्च करनी पड़ेगी कि ओके, इन्होंने यहाँ पे कौन कौन सी चीज़ें डेवलप की हैं, इनके स्टूडेंट्स कहाँ कहाँ मैच हुए हैं in fellowships, what is their fellowship match rate,
What
stuff
are
like
their
that.
goals? What's important to the program? What are they looking for? And these things you're gonna find on their websites,
Mhm.
and it'll help you, it'll guide you for the
Like for big university
Yeah.
programs, they are the ones who usually value research a lot. So
Mhm.
if you tell them, okay, I would I want to work on this project, I want to do that, they are going to like that. For smaller community programs, let's say you have a community program in Texas, to mention ke, okay, I do like working with people, I like volunteering, I like talking to the people, I can improve your community this way.
Yeah, and giving back to the community in
So
any
they
way.
would really like that.
Mhm.
So इस तरह आप prepare करते हैं इंटरव्यूज में you बहुत कम होगा कि they would ask you behavioral questions or ethical questions.
I had one program that did that, and it was just their vibe was very off for me. So I ended up like ranking them very low as well, because if they ask you something like that, that's telling you a lot about the program. And if they're asking you things about yourself and things about your journey, then that means,
इधर एक
nothing.
बात important ये है कि you need to show your all-rounded personality. You can't be like a total I don't want to use this term, but you can't be a total nerd and and just be one-dimensional. Because when people ask you, people would be like, okay, if you are interviewing in Chicago, you should know something about Chicago. You should know Michael Jordan played there. You should know something about the community. Then you can say, okay, I'm interested, I like following soccer or football, I like doing this, I like eating pizzas, and Chicago pizza is really famous and stuff like that. So you need to show that you would be a
Yes.
good fit into their team.
Mhm.
Because they like people who they like residents who are friends with each other, and they can work with their seniors as well,
Mhm.
because they go out on wellness events, they go out playing golf and stuff like that. So you need to fit in. तो उस पे आपको शो करना चाहिए कि मैं मेरी एक्स्ट्रा करिकुलर क्या एक्टिविटीज़ हैं। इसमें बहुत इंपॉर्टेंट है, अगर किसी ने स्पोर्ट्स वीक में पार्टिसिपेट किया है,
Do mention that.
do mention that. I mentioned I played soccer, I played basketball, Tehrim was in the dramatics team. So and there is a whole conversation about that. They
Yeah.
would ask you, okay, what was the drama about?
Yeah.
What did you do? What was your role?
Yeah.
And stuff like that. तो उधर से आपको वाइब भी पता लग जाती है प्रोग्राम की, whether they like you or not, and आपको काफ़ी आइडिया हो जाता है.
Mhm.
तो दिस इज हाउ आई प्रिपेयर्ड फॉर माय इंटरव्यूज. एंड प्रिपरेशन के हवाले से यू डू गिव मॉक इंटरव्यूज. जिस तरह मैंने डॉक्टर साद को दिया था, इसके अलावा मैंने एक और भाई थे फ्रॉम किंग एडवर्ड, ही इज़ अ रेडियोलॉजिस्ट इन द यूएस, मैंने उनको 2 दफ़ा मॉक इंटरव्यूज़ और उसकी प्रेप कराते देखा था. तो आई थिंक दैट हेल्प मी अ लॉट. एंड आई थिंक अगर आपको इंटरव्यूज़ आ रहे हैं, आई थिंक अगर आपको 5 इंटरव्यूज आए हैं, तो आई थिंक द मैच रेट विद 5 इंटरव्यूज इज क्लोज टू लाइक 80%, 80-90%. सो if you get 5 interviews, that's a great. If you get 10 interviews, then your match rate is going to be close to 96%, I think.
Yeah, but then again, I would like to mention कि कभी भी कुछ certain नहीं होता, because we've seen people with 14 interviews with 270s, go unmatched in a match cycle, because there's a lot of things that are playing into you matching.
And
It's
then
just not
yeah,
your scores. It's not entirely. It's a lot of it is your personality. If you can talk to the other person, if you're likable, if it's how you're presenting yourself. So you have to take care of a lot of things and be, like Essen mentioned, kind of be able to show that you can do a lot of things and you are an all-rounder. So
and something I wanted to add. Um, someone said that someone asked that, do you send thank you letters after your interviews? Yes, you do. It's good. This is like good communication with the program. They don't usually reply, but this is good. You would like to thank the coordinator, the program director, any other person that you interviewed. These are good manners. Um, and people, and I was giving interviews in Pakistan, so you had to be sure of the schedule, because they in the US it was usually 8 or 10 a.m., and in Pakistan at the time I was doing my interviews in the evening time or sometimes late at night. So you have to keep that in mind, the schedule. And were there any interviews that you had bombed? Okay, not really. Someone asked me that. Okay, not really. but you do make certain mistakes and you learn from them.
You can feel down after, let's say, and I wouldn't say bombed an interview, but I would say that there are certain interviews that you're gonna do and you don't feel like you did your best. And that's okay.
Yeah.
That's okay. Because a lot of people sometimes do end up matching in places that they think, oh, I didn't do that.
Yeah.
Like my interview didn't go that
I've
well.
seen so many people match
Yeah.
with one interview.
Yeah.
I've seen so many people match who only had one interview from September to February, and they thought that they were done, and
Yeah.
and that didn't even go well for them, and they matched. So
Yes.
so it's totally up to your
It's
luck.
chance,
It's
it's
chance, luck.
it's a lot of
Just so
things.
just pray a lot.
Yes.
So I think that's it. Oh yeah, this is an important question. What factors influence your rank list?
Oh,
Okay.
so
So number one, the vibe of the program. What you can feel the vibe during your interviews. Usually you can also talk to the residents who are currently working at the program, and you can ask them questions regarding their schedules, how many calls are there, what is the structure. Okay, so most programs in the US, they have a cap at about 20 hours or 24 hours. My program has it at 16 hours. So you can't work more than that. So that takes in, so that is a good helpful criteria to judge a program.
resident wellness,
Resident wellness.
important or how big they are on resident wellness, because you're going to be working a lot in residency, you're going to be learning a lot in residency. So make sure the program that you do decide to rank higher prioritizes your wellness and that you are important. You are an important asset to them. So
Location is also an important factor for
Yes.
your rank list. If you have family in Texas, you want to rank Texas number one, as compared, or if you want to be in Chicago, or if you want to be in Florida, just rank that place. But it also depends on, personally, liked to look up their fellowship match rates. So how many people matched into cardiology, how many people matched into
yes,
gastroenterology.
that's
If something that is important for you, then I look that up. And one thing important is, do they have in-house fellowships or not? If a program has in-house cardiology, GI, hem-onc fellowships, I would rank that higher, because then your chances of matching in a fellowship increase, as compared to a smaller community program that does not have fellowships. So, okay, I think that is it. I think that is it from our side.
But
Shall
then
we move? Yes, yeah.
oh, go ahead.
Yeah, I'll baat kare. हाँ जी.
Okay, so I just wanted to add the vibe thing is so important because I had one program which did have fellowships, but I ranked a program higher which didn't have fellowships because I did not enjoy the vibe during the interview. I was put off, and they did have fellowships, and it's important for me, obviously, but I wanted to be somewhere where the next 3 years, like, I'm happy and I'm content. So that is just the last bit.
So we have a few questions in the chat box. I'll read them out. So the first is by Zishan. Is Masters in Public Health or Neurosciences, etc. good way to get into US as a doctor?
That's a good way to get into the US, but not as a doctor.
That's what I thought.
So because MPH helps you a lot. Most attendings do MPH who want to take up an administrative job. So it helps you later in your career, but does not help you a lot in the residency match application.
Okay. Dr. Fatma Hussain is asking, what if you have done with a house job and now planning on taking steps? So when to apply for visa and for rotations?
Apply for the visa right now. Study for the steps right away, and then when you have visa in hand, you can go for rotations. Just start everything right now. Yeah. After you're done with house job, you can just start everything right now.
Then we've got from Zishan, if someone has passed 15, 20 years of graduation, is there a chance of getting a match? Wow.
Oh,
Yes. Yes. I mean, if I'm never gonna say no to stuff like this because we have seen cases. There have been cases where there was this one that was on the news when we were applying, that a mother and a son, they got into residency together.
Wow.
So
Wow.
they were residents together in the same program. So
Wow.
yeah.
Uh, Actually, the chances would be much lower than a recent graduate, of course. But then you have to do different things. You can work with in a program where you are actually in touch with the program leadership who, and you work with them for 6 months, let's say, or a year. Usually people after 15 to 20 years, those are the people who are done with everything, who have kids, who didn't pursue USMLEs because of their family situations. Now they're in the US after their marriage or whatever, and now they're looking to get it back into the healthcare system. It would be harder, but now you have to make those connections. जिस तरह ये लोग मैच होते हैं 15 to 20 years बाद, वो काफ़ी टाइम उनके क्लिनिक पे, उनके हॉस्पिटल पे काम करते हैं in any aspect. They could be a medical scribe, they could be an observer, a medical assistant, and then the program director or the leadership, they know this person for a year, and they know that ये बंदा इसको हमारे सारे कल्चर का पता है, इसको हमारे हेल्थ हॉस्पिटल के हेल्थ केयर सिस्टम का पता है, and then they probably rank him. But if they only if they take the route that recent grads do, just doing step 1 step 2 and 2 to 3 months of observerships, I think उसमें थोड़ा कम होगा उनका chance to match, because you would be filtered out of the 5 year cut off. तो इसके लिए आपको एक बंदा चाहिए इन द प्रोग्राम जो कि आपकी एप्लीकेशन निकाले फ्रॉम द कट ऑफ, सो दे एक्चुअली लुक यू अप and then they look at your application.
So here I would like to add one thing, and correct me if I'm wrong, because obviously I'm not very well versed with the US system. मैं खुद यहाँ UK में इंटरव्यूज में आता हूँ as an interviewer. एक जो चीज है ना वो ये है कि जो एक सक्सेसफुल कैंडिडेट्स में इंटरव्यूअर्स देख रहे होते हैं, the art of selling yourself. ठीक है, how you sell yourself, how you sell your achievements to the interviewer. अगर आप 15 साल बाद ग्रेजुएशन के अप्लाई कर रहे हैं स्टेप्स में, ठीक है, चांस कम है, इट्स ऑब्वियस, लेकिन उन 15 सालों में आपने किया क्या? अगर उन 15 सालों में आपने कुछ अचीवमेंट्स किए हैं, कुछ मे बी आपने कोई ऐसी एक्स्ट्रॉर्डिनरी अचीवमेंट की है कि आपको कोई अवार्ड मिला, फॉर एग्जांपल एक्सीलेंट क्लिनिकल केयर पे, या आपने कोई एक ऐसा रिसर्च आर्टिकल पब्लिश किया है जो कि बहुत ज्यादा कोट हुआ है दूसरी रिसर्चेस में, जिसने ग्राउंड ब्रेकिंग रिसर्च की है, या something extraordinary in the 15, then focus on that interview promoting what you have done. Maybe that may lead to success. Chances are low, but still, just sell yourself so much कि इंटरव्यूअर बोले हाँ यार ठीक है, इसने कुछ किया अपनी जिंदगी में, वेला नहीं बैठा हुआ, ठीक है. Just my thought. I don't know if you guys agree.
No, absolutely. And also, like I mentioned pehle, I have a PGY2 in my program who has kids that are like 10, 11, 12 years old. So she's like a year older. So I mean, no, sorry, not a year, like a year in seniority in terms of, but she's a lot older than all of us. And if she can match, then, you know.
Hamad is asking any comments on dermatology as a specialty.
Dermatology as a specialty is great, but amazing. They have a great lifestyle, they have amazing salaries. The problem is all of the US grads are going for it. So you would be competing against grads from great universities in the US, because for dermatology, even American grads from smaller universities go unmatched.
Yeah.
So and for dermatology, you need to do 1 year of prelim internal medicine and then 3 years of dermatology. So dermatology is going to be very hard. It is going to, you need the same route that I mentioned for surgery,
orthopedic.
For all of these competitive specialties, you need to do a research year at a good university. At least one year.
Yeah, but you could probably need more for derma. For orthopedics, you would need more.
Another एक और alternate route वो ये है कि some people that I have seen go through this, that is they apply for internal medicine, they complete 3 years of internal medicine, and then they apply for dermatology.
Yes. And you can get in that way.
And you can get in that way because you know the system,
You've
trained in the US, you can get good US letters of recommendation, and you're just hands-on with everything. So it just makes it slightly easier as compared to someone who's coming directly from Pakistan and applying it to dermatology.
But then again, it comes with, it has its own
Pros and cons, because you waste 3 years of
yeah,
internal
because
medicine.
you did 3 years of internal medicine residency, and then now you're gonna go into the dermatology residency, and it's gonna be another 3 years. So you're gonna be basically a resident.
I think your last question, well, not precisely last, but one of the last questions is by Fatima. Can these documents, such as dean's letter and letter of recommendation from the head of department, be written and signed by the respective personnel right final year, even though you plan to apply after 2 years of graduation?
Yes,
Okay.
100%. Sometimes what people do, they actually get that document, they have that prepared, and sometimes if you want a recent date on that document, you can probably just show them again right before you apply, and then they can just update the date. So let's say you can get the document in 2024 and you want to apply in 2026. You can still use that 2024 document, but if you want to add something, you can add that 2026 date right before application.
Yep.
But that's
And
a
the
good
last, yeah, the last question is by Dr. Ruman, IMSEL question mark. I haven't got a clue what that
Yeah,
means.
so this is IMSEL that I mentioned. So this is
I'm a
internal
CL.
medicine structured evaluation letter that you get from your head of department. So in my case, I got that from Dr. Muzammil. And this is the this is a type of a letter of recommendation that can only be given by your head of
Your-
department.
At your college.
Yeah, from your med school. Dr. Sam, I think I received a few messages in as in my direct chat.
Okay,
Okay,
go ahead. Yeah.
yeah. So could you please talk about the ERAS CV, especially the experiences that you have to write? Okay, so this is a very important question because your CV is really important. In your CV, there are going to be 10 experiences that you can add. Okay, so for those 10 experiences, three should be at least three should be your observerships. So you mentioned your sorry, your internal medicine observership, your internal medicine externship, or whatever you call it. Um, you need to show in the detailed description of your experience, you need to add what did you learn, did you give any presentations during that rotation, did you write histories and notes and progress notes and stuff like that. So those are the three most important experiences, and you can also add that as your meaningful experience, telling them, okay, what was something meaningful about that rotation. So out of 10, three should be your observerships. You can add one volunteer experience as well. They value volunteer experiences massively. So it could be anything, including your, let's say it could be a tree plantation drive. It could be you worked with a animal shelter organization. It could be anything. It doesn't have to be medical related anyway. You can also add your extracurriculars, just like I said. You can add you were a soccer player in your med school, your team won those two competitions, or you worked as a director of the short videography competition. So it could be anything.
Yeah.
Show yourself as a complete personality.
Yes. So it can be
Um,
basically like anything. But yeah, the three that he mentioned, they have to be like your observerships and things that are actually high related first.
You can add a research experience as well.
Yes.
It could be a month, it could be a week, it could be anything. Just add that in your experience. Okay, I worked with this group of people, this organization for a week or a month. Usually, it's about 3 months because it takes about at least 3 months to publish something if you are working with a group. You can add that experience, and that helps a lot as well. Um, what else? So observerships, volunteer experiences, research,
I think that's it. And then extracurriculars.
and extracurricular.
Yeah.
I think that's enough.
it.
Yeah,
Yeah.
that's it. And these span from your medical school. So you can add things from medical school after graduation. try to not leave a gap in your CV. You can add, of course, you can add your house job if you've done that. You can add your house job. Okay, I rotated in medicine, peds, surgery, and anesthesiology, and you can create a good comprehensive description of your house job experience.
And you would always be asked about your gaps in the CV in your interviews. Every single interview is going to ask you that.
So to reduce that gap, let's say you are done with your med school. Now you're studying for step 1 and step 2. You're only studying for this exams. You cannot add that as an experience. So during that time, take up a volunteer job. Not a job, it's just something that you do occasionally. Take up a publication or work with an organization so that you can cover that gap in your CV. So let's say you graduated in May 2022. You need to show, okay, from June 2022 to November, I was doing this. From December, I was doing this until March. And then this and this from June to September. So you cover everything. If there is a gap of about a month or two, it's not going to hurt you or in any way, but just not major gaps. So, and another question that I got in my direct message was, should I buy UWorld from the start? From where I can get free practice UWorld questions? Is there any link? So UWorld, you have to buy that. There are no free practice questions.
And they're not recommended either, because the learning that you get from doing a question, getting it wrong or getting it right, the level of learning that you're gonna get through the doing them on your own like that is not gonna, it's not comparable to getting a book from somewhere which has the questions written in it and you're just reading the information. So
because UWorld tells you about your weak areas, it tells you about your stronger areas, it gives you a whole graph of your progress. So you should be doing UWorld online. So I don't endorse anything that is
Yes.
offline for UWorld. Okay, someone asked me, okay, few insights about personal statements. Okay, so personal statement is another part of your application, an important part of your application. But it is something that has been hyped up a lot. People say you need to be stellar in your personal statement, or you need to be very unique. Um, I feel like personal statement does not hold a value as much as a CV, of course. But you can show, but this is your place. You can do anything with your personal statement. You should show yourself. Okay, a story. You can add an inspirational story. You can add something from your life, any event that motivated you, inspired you. But some things that you should definitely cover in your personal statement are why are you coming to the US?
And why you're interested in whichever specialty that you're applying into. What made you want to go into the specialty that you're choosing?
Yeah. And what can you give back to the community? And what are your aspirations in the future? So what do you want to become? So these are this is not a template, but usually you need to include those like 4 or 5 things in your personal statement, and it should not be too long. Nobody is going to read the second page of your personal statement. Keep it under a page. Usually it is only to filter out applications. If there are mistakes, grammatical mistakes in your personal statement, you would be filtered out. They would say, okay, this person cannot write a sentence without making a grammatical mistake. We cannot be liable for a person like that in our residency. So don't make any mistakes. Use Grammarly, use Quiltbot, or anything. Just don't make it too AI generated. I think
this is what I was gonna add, that don't use Chat GPT and copy the entire thing in your personal statement, because they're gonna they can help.
Make that personalized, but make it grammatically correct. It should have a good flow. I read a personal statement from a person from King Edward, and he liked Naruto, which is, I think, people know about Naruto. It's I think a Korean drama. I think.
No, it's like a
It's like it's like a cartoon.
cartoon
And he
that we
and
grew up
and,
watching
and that
in
is
the
something that
US.
inspired him. So he wrote his whole story based on that how that drama inspired him and stuff like that. So it could be anything. It could be a patient, it could be something from your family, it could be a patient encounter that inspired you to become a better physician.
Also guys, एक बहुत important चीज is जो vocab आपकी आम जुबान में नहीं है, ठीक है, don't put बहुत मुश्किल words into your personal statement क्योंकि उन्हें पता लग जाएगा, उन्होंने सब कुछ खोला होता है when they're interviewing you. So if you have like really big words in your personal statement and when they're talking to you and you're not able to come up with, you know, the same type of vocab that's in your personal statement, वो पता लग जाएगा कि इस बंदे ने, you know, कुछ ना कुछ किया है. Because इसलिए ये बहुत important है that you do use the type of language that you would normally.
For personal statement, I feel, and Dr. Hassan told me as well, just keep it simple. बेशक वो थोड़ी जेनेरिक हो, बेशक वो बाकी लोगों से मिलती जुलती हो, बिकॉज आफ्टर all people coming from Pakistan have a similar kind of a story. Some people add a story about their grandparents, how their illness actually shaped their life and stuff like that, and most people have the same story. And it's fine, there's no issue with that. ऐसा बहुत कम होगा कि आपकी सीवी अच्छी नहीं है, आपके स्कोर्स अच्छे नहीं हैं और आपकी पर्सनल स्टेटमेंट इतनी अच्छी है कि उन्होंने आपको इंटरव्यू दे दिया. ऐसा बहुत रेयर होगा. यूजुअली ये ज़्यादा होता है कि किसी के स्कोर्स अच्छे हैं, किसी की सीवी अच्छी है, लेकिन उसकी पर्सनल स्टेटमेंट इतनी ख़राब है कि उन्होंने उसको इंटरव्यू नहीं भेजा. ये हो सकता है. Usually, if you have good enough, have a good enough score, have a good CV, just make a simple, basic personal statement, which is grammatically correct, doesn't have any mistakes, doesn't have बहुत ही कोई अजीब सी बात, which is off-putting, and usually programs usually just say, okay, give this guy an interview if you have an all-rounded application. I think I received.
If you do have a gap, how to cover that if you were doing prep for steps? Now, this is a very hard question,
Okay,
actually.
I feel like a gap आपका कुछ ना कुछ हो ही जाता है, हो
होगा,
जाता है
it's very
gap.
natural.
तो steps की prep करते हुए you would have a gap. Could be 6 months, could be a year. Usually if you are within that 3-year cutoff for after graduation या 3 या 5 year cutoff, कोई बंदा बहुत ज़्यादा इन डिटेल आपसे नहीं पूछेगा कि आपने उन 6 महीने में या 8 महीने में क्या किया था. और अगर कोई पूछ भी लेता है, you just say I was preparing for my step
यही
exam.
मैं कहने लगी थी कि if you have absolutely nothing, just be honest. Be like, okay, I took my time and I was just preparing for steps. And I think we did.
Usually this matters. Usually this matters when you are close to that 5-year cutoff and programs are interested. Okay, you have a 2 साल का gap after your graduation. What were you doing in that period? It's
Even
not.
if, even if you were, let's say, going through a hardship during that time and you didn't do any, you didn't study, you didn't do anything, you weren't working anywhere, mention that, you know, I was going through family issues or I was going through financial issues or anything that you were facing. You don't have to make something up to cover up a gap. So just be honest.
Just be honest with that. और बल्कि काफ़ी लोग इस तरह करते हैं. You can also address that in your personal statement because this is your time to sell yourself. आप उसमें कह सकते हैं कि after graduation this happened. अगर कोई story है वाकई में कि this happened and I couldn't do anything for this period. I was going through this hardship. I was going through this, and usually programs understand that, and usually they know कि IMGs, they take a year or a year and a half to prepare for step exams. They know that. So
they know कि उनकी हम लोगों की पढ़ाई back in Pakistan, back in India, and anywhere else in the world is not like how it is in the US. Because in the US it is directed towards getting you to pass your step exams, and it's directed to prepare you so well. But we have deficits in our you know, educational system, and that is something that they all know.
Yeah. So as long as you are within that 3 and 5-year cutoffs, you're good.
Oh, also house job if you have done house job, that can also be added as an experience in your CV, which is and which is matlab there could be a good factor in your role because they could ask you, okay, so what did you do in house job? What kind of procedures did you do? What did you learn? So it's not entirely low if you do it.
Do you have more questions?
No, we're done.
Right. I think, is it fair to come to a conclusion now?
Yeah.
Okay. So I'd like to share a little story. Around about last year, I was in Canada. अपनी खाला से मैं मिलने गया था in a place called Windsor. तो
We
मेरा कजन मुझे
we were
कहता है
there.
कि यार अपना अमेरिका साथ ही है तो
हाँ।
वो आते हैं, तो मैंने कहा यार व्हाई नॉट। तो डिट्रॉइट जो लंबी बिल्डिंग्स हैं टाउन सेंटर की ना, वो
Yes.
विंडसर से नजर आती हैं। तो हम वो उधर खड़े थे, वो एक एम्बेसडर ब्रिज है, तो
Yeah.
उसने कहा कि I'll just take you across the ambassador bridge। तो मैंने कहा वो चलते हैं यार। तो
हम्म,
हम गए, तो I had heard these horror stories about how they treat, because I've never been to the US before, how the US immigration officers treat these people who come there for the first time. But actually, when I went to the border control, they were extremely polite and nice to me. One of the ladies actually ended up asking me, "Oh, tell me about England. How is it? And the rain and everything. Is that real? Yeah, it rains all the time in England. Yeah." So, and I came to, it was just a day trip. So I visited the Ford Museum, and I went through some streets of Dearborn, and we spent a very nice day. We traveled across the some streets which I don't remember their names very well, and then we saw the city center is called downtown, I think, and then we came back the same day. So I had a lovely time, but I did not know a year before that a year later, that is today, I will be arranging an interview for the two rising stars of our medical college, matching in Michigan. Extremely happy for this wonderful talk, and thank you guys so much.
Thank
Thank
Um,
you so much for inviting
yeah,
us.
yeah, absolutely. Obviously, if we have made it very clear today that if anyone has more questions,
you.
they will be asking you in the future, और आज की जो सारी recording है वो मैं लगा दूंगा medical pearls के ऊपर भी। तो लेट्स लुक फॉरवर्ड कि आपकी इस टॉक से आज डेफिनेटली लोग फैसिनेट हुए हैं, और वो जो है अपना प्लान करेंगे, और अपने अंदर जो उनका एक क्वेश्चन है ना, जो एक शक है कि मैं कर सकता हूँ या मैं नहीं कर सकता, या कर सकती हूँ नहीं कर सकती, that would have been addressed today. And special thanks to Tehrim, क्योंकि आप जो आई हैं यहाँ पे, I think you are the first female doctor who has done USMLE, who has come on my platform, really. So it means a lot to me from that perspective as well. And I'm sure कि आप लोगों को देख के और भी बहुत सारे लोग inspire होंगे. That's the whole reason of this group, where I take time out of my work life and family life, to dedicate to one medical college. So with that good note, we end today's talk, and thank you very much. And hopefully
Thank you so
I'll
much.
see you in real life. Yeah. If you guys ever come to the UK, please give me a shout.
Inshallah,
I would
inshallah,
absolutely
inshallah,
love to take you around. ठीक है, अपने घर भी welcome करूंगा इंशाल्लाह, ठीक है?
inshallah,
अल्लाह
inshallah. You
हाफिज।
too, if you come back,
Oh
please do.
yeah. I do intend to. मैं भी अकेला गया था last year. मेरी वाइफ और मेरे बच्चे पाकिस्तान में थे, तो अब मैंने उनसे प्रॉमिस किया कि नेक्स्ट टाइम मैं उनको लेके जाऊंगा। डेफिनेटली कनाडा विंडसर दोबारा जाएंगे, और फिर मिशिगन।
Yeah, we were there. We were there in Windsor like
Yeah,
four,
a
4 or
couple
5. Yeah,
weeks ago.
अच्छा अच्छा
yeah.
सही।
We were there at Caesar's Palace.
अच्छा सीजर्स, हाँ। कोई इतना एक्स्ट्रॉर्डिनरी तो नहीं है वैसे,
कुछ नहीं था,
लेकिन
कुछ खास नहीं था।
हाँ बिल्कुल,
हाँ।
हमें तो बिल्कुल, मुझे तो अपना डाउनटाउन ज्यादा अच्छा लगता है।
ओके, अल्लाह हाफिज, टेक केयर।
Okay, okay.